Hi, this is Chet Kuhn with Medicare Hero, and I want to take a few minutes and share an experience that I just had with a client that I was working with. This experience is a very common scenario that a lot of folks have questions about. And what it has to do with is if you have a Medicare supplement plan, if you've had it for more than 1 or 2 years, then likely you've started to get some rate increases and your prices have started to go up and up year after year. And this client I just worked with loved the Medicare supplement coverage. It was fantastic coverage, didn't want to change anything about that, and was pretty hesitant about trying to save any money even though her premiums had significantly increased because she was too afraid of changing anything in her coverage. And so we worked together to look at what the options were for her to keep the exact same Medicare supplement coverage, but lower the monthly premiums that she's currently paying. And we actually succeeded tremendously in lowering her premiums. And I'm going to show you exactly the scenario that we went through and how we ended up saving her money on her monthly premiums. So follow along. Starting off, she sent me an email, and I have X'd out a lot of the information, anything that was personal here. And so essentially, her Medicare supplement coverage from, we'll leave the company unnamed, started in 2017, in September of 2017. Her first premium was $112 a month, a very good deal, and she had a Medicare Supplement Plan G. Now, in 2018, September of 2018, her premiums went from $112 a month up to $127 a month, which is a pretty good increase. That was okay. She stuck with it for another year. And now in September of 2019, her premiums just jumped up to $161 a month. From $127 up to $161 a month. A huge increase. If we do the quick math here, her premiums from when she first started went up $49 a month, or $588 a year. She's paying more than when she started. It's unbelievable. And so she really didn't want to have to pay this nearly $600 rate increase that she's gotten over the years. But again, she loved that Medicare supplement, that Plan G coverage. And so let me show you kind of what we talked through together. The first thing we did is she called into my office, and we first talked about how Medicare supplement plans work. So I like to show everybody that this is a 2019 Choosing a Medigap Policy Buyer's Guide. It's actually published by the Centers for Medicare and Medicaid Services. So this is a guide published by Medicare itself to help you be an educated consumer when you're buying a Medicare supplement plan. They don't want you to get ripped off or get a bad deal or overcharged. They want you to know how these plans work so that you can get the best deal possible. So on page 11 of this buyer's guide, and I just simplified it here, made it a little bit shorter. On page 11, you'll see a chart. Let me see if I can zoom in. Now this chart, as you may have seen before, are the various Medicare supplement plans available to be sold. So insurance companies can choose to offer Plan F, Plan G, Plan N. They can pick one of these Medicare supplement plans or multiple plans to offer in the market. But when they offer one of these plans, such as Plan G, the benefits are set already. Insurance companies are not allowed to change anything. They have to offer the exact same Plan G coverage that every other insurance company offers. So no matter whether you get Plan G through Bluecross Blueshield, Aetna, Cigna, Mutual of Omaha, United Healthcare, anyone, it's the exact same Plan G coverage as the next company. Everything is 100% identical. So you don't have to worry about your benefits changing if you were to switch from one company to the other, as long as you keep the same plan. So if you have Plan G, if you switch to Plan G, it's going to be identical coverage. If you have Plan F and you switch to another Plan F, it's again going to be identical coverage. So just to prove this point, if we go down to page 19 in this Medigap Buyer's Guide, again, this is published by Medicare itself. Right here at the top of page 19, it says, as discussed on previous pages, the cost of Medigap policies, Medigap is another term for Medicare Supplement policies, the cost of Medigap policies can vary widely. There can be a big difference in the premiums that different insurance companies charge for exactly the same coverage. So that's it right there. Medicare is trying to explain that there can be big differences in what insurance companies charge for the exact same coverage. So unlike a whole lot of other type of insurances that are different and more complicated, Medicare supplement plans are very easy. There's no reason to overpay for a Medicare supplement plan. Okay? So now that we understand that Plan G is Plan G no matter who we get it through, the next step was to find out if we could find that Plan G for a better price. Now, if you remember, this particular client ended up paying $161 a month. That was her current premium for Plan G. So we pulled up our quoting software, and this is our quoting software that we have. All of the insurance companies in green are companies that are A+ rated insurance companies that offer Plan G for a significantly lower premium than what she was currently paying. So as you can see, Humana charges $108 a month for this particular client. Mutual of Omaha charges $108 as well. They're a great company. Aetna charges $111 a month. Cigna is $120 a month. And then we get to the companies that were actually more expensive than she was paying. These companies couldn't save her any money. The AARP United Healthcare Plan, Bluecross Blueshield, Thrivent, and other companies, and they continue down. But she had 4 great options to significantly save on her Medicare supplement premiums. Now these premiums are unique to each individual person, and as you can see right up here, we've got her zip code entered, age, that she's a female, doesn't use tobacco products, and for Plan G. And so we identified 4 great companies that she could go with. Now, the next step is if you have a Medicare supplement plan and you want to switch to a different company, that new company you want to switch to is allowed to ask you some health questions, and we have to get accepted by that new company before we can switch over. And so it's important to look through the health questions and talk through those to make sure that there's nothing that comes up. And as long as we can answer a few simple yes or no health questions, as long as we can answer those no, applying for coverage is really no issue at all. And so next what we did is we pulled up the health questions. So Humana and Mutual of Omaha were the least expensive companies. Aetna was only a few dollars more. Due to the size of the company and the stability in their rate increases, I recommended my client preferred to start off with Mutual of Omaha to look at their health questions first because they've been around for a long time. They have stable, low rate increases, so they tend to not raise their premiums much from year to year. And so that's where we started. Now, this is just a page from the application. And I know it looks a little bit complicated, but it's fairly simple. There's about 17 yes or no health questions, such as, are you confined to a wheelchair or any motorized mobility device? Well, we could answer that no, in her case. Are you currently hospitalized, confined to a bed, in a nursing home, assisted living facility? Well, no. You come down, do you have a cardiac defibrillator? Do you have a implanted cardiac defibrillator? As long as we can answer these roughly 17 health questions, no, we have about a 98% chance that we're going to get approved for this policy. Now, the good news is it's a win-win situation, or there's nothing to risk, because we can apply for this Medicare supplement plan, and if we, for some odd reason, are not approved, we just stick with our same Medicare supplement policy we have today. Doesn't affect anything. But if we are approved by the new plan for a significantly lower premium, then we can go ahead and say, yes, I'd like to switch over at that time and switch to the new policy. So it's a no-risk scenario where we can potentially save hundreds of dollars a year on our Medicare supplement premium, and we have nothing to lose. And so we went through these health questions. She was able to answer them all no, and we then moved on to applying for the policy. Now, applying for the policy is actually extremely simple. I was able to ask her a few questions, and within about 10 minutes, we had the application submitted. Everything was done. In about 6 or 7 days, she's going to hear back from the insurance company, likely that she was approved for a significantly lower premium. When she's approved for this new policy with the lower rates, she's going to save about $636 per year in premiums. She was able to lower her premiums from $161 a month all the way to $108 a month, which is unbelievable. The $108 a month is even lower than she originally started 3 years ago. So that's a tremendous savings. Over the next 5 years, she's going to save more than $3,000 on her Medicare supplement premiums. Very worth a 15-minute phone call. So if you have a Medicare supplement plan, if your premiums have been going up recently over the last few years, or if you just want to make sure you're still getting the best deal possible, give us a call. Our team here at Medicare Hero, we're a family-owned business. We'll help you shop all the plans available or all the companies available and help make sure you have the best deal possible for your Medicare supplement plan. So if you have any questions at all or would like to save on your Medicare supplement premiums and like to check out those prices, go ahead and give us a call. Our number is 1-888-321-6361. Give us a call. We're a family-owned business. We'll be happy to help you. Don't worry about calling an 800 number. You always get a live person on the phone right away. Thank you so much. Thanks for joining us.